Hi, and welcome to another episode of The PH. I'm your host, Donnell Christian. Today's episode is especially for our expectant moms. We're going to discuss pregnancy during the pandemic. But first, take a look at our terms and definitions. Pregnancy and care of pregnant women are associated with several terms like obstetrics. This refers to a branch of medicine that specializes in the care of women during pregnancy and childbirth. Antenatal or prenatal care refers to routine health care of pregnant women to diagnose diseases or conditions without symptoms and to provide information about lifestyle, pregnancy, and delivery. Telemedicine literally means healing at a distance and signifies the use of ICT to increase access to care and medical information. You'll hear these words frequently in today's feature. Pregnant women are at increased risk of becoming severely ill from COVID-19. Hospitals and health centers have responded to the risk by creating new protocols. According to the Centers for Disease Control and Prevention (CDC), some of the recommended protocols that should be implemented in healthcare are ensuring healthcare professionals are well trained on the use of personal protective equipment, developing protocols for healthcare professionals to monitor themselves and patients for symptoms of COVID-19, using telehealth strategies to provide high-quality patient care, and setting up an emergency operations center. These and other strategies are currently being implemented in Jamaica and across the globe to protect patients and healthcare workers from being exposed to COVID-19. So how do pregnant women fit into this picture? Pregnant patients use health services frequently during antenatal care, as well as after their babies are born. They have routine checkups and examinations, special visits, and ultrasounds. If they currently have a lifestyle disease, this requires additional care during the 9 months to ensure that the mother and baby are doing well.
The risk for severe illness is elevated, and that risk for severe illness is even more elevated once the patient has a comorbidity, another illness like diabetes or hypertension. And as it relates to being high risk, you're deemed high risk in a pregnancy when there is increased risk of illness or even death to the baby and or the mommy, usually because of some kind of comorbidity or pregnancy-related illness that can develop. That is more likely to be 1, hospitalized, 2, require oxygen, 3, require high flow oxygen, or 4, even require a ventilator. They may require ventilatory support. So the severity of the illness is increased. High-risk pregnant women should take the steps that we all take, which should be 1, it kind of sounds like we're saying it ad nauseum, but it's important. So 1, observation of hand washing, where you are unable to wash your hands, sanitize. Resist the urge to touch the face, especially the eyes, or put the hands in the mouth. Mask wearing, can't overemphasize mask wearing. Social distancing, particularly in the case where you need to come out. So you need to come out for your visit. But even at your visit, you need to observe you're 6 feet apart from the other patient waiting, and you're 6 feet apart from the doctor, while you're just talking to the doctor and not being examined, right? And then, of course, the extra layer of protection that we now have is vaccination, right? The caregivers or anybody really in the household that comes into contact constantly with a pregnant patient needs to be extra cautious, because you're now in the household with somebody who is at an increased risk of severe illness, especially as a pregnant woman with a comorbidity, right? And so these persons must, again, observe all protocols as mentioned previously, and their extra layer would be that of vaccination as well.
The Guideline for the Management of Pregnancy during the COVID-19 pandemic, which was developed by the Ministry of Health and Wellness, outlines protocols that were specifically designed to manage obstetric care in developing countries where resources may be limited. The guidebook covers the provision of healthcare from the beginning of pregnancy to neonatal care. It also includes management of outpatient services as well as screening, which is critical during pregnancy.
I don't think I can overemphasize the fact that the pandemic has caused a significant strain for the healthcare system overall. So we hear about first world countries buckling under the pressure. For us as a third world country, we can just imagine what it's doing to us. So for our maternal services, those have also suffered significantly in the name of social distancing, in the hopes of reducing exposure of our patients who have to take multiple modes of public transportation to get to their antenatal visits. We have had to reduce the numbers of patients we see on any particular day. So we've cut the numbers. We have also spaced out the number of visits a patient may have. So originally you may have been seen in the past pre-pandemic, every 4 weeks, then every 2 weeks, then weekly. But in order for us to be able to manage the numbers, to reduce exposure for the patients themselves and for us as well as for healthcare workers, we have had to space out the number of visits that patients have had. So what this essentially means is that as a pregnant woman being seen particularly in the public health system, you may not have as much visits as someone would have had pre-pandemic. And because of that, a lot of the responsibility is now shifted over to the patient in terms of ensuring that they are remaining healthy in between visits and that they know how to or when to seek attention between visits if they think something is wrong. The second thing is that we have had to ensure that our educational talks in the morning are well received by patients. So, as Caribbean people, we tend to like to watch and wait if we feel sick. What we've had to be telling our patients is that if you do have any symptoms that suggest that, a flu-like illness, a little viral illness, you're not feeling very well because COVID-19 presents in weird and wonderful ways, we encourage them to seek healthcare early so that if something is wrong and it is COVID-19, we can nip it in the bud from early. Far too often we have patients who come in having had symptoms for days and they're watching it at home, and it's when it's too late that they're coming in to seek further attention. So we've had to ramp up our educational talks in the morning, and we hope that patients are receptive to those talks and take heed with some of the information that's given and seek attention early rather than late.
Strategies are also in place for midwife-led community antenatal clinics. These interventions include instituting strict appointment schedules with staggered arrival times for women and instituting a more efficient approach to scheduling of antenatal visits. But what if the patient is pregnant and is suspected of having COVID-19? According to the Ministry of Health and Wellness, it is recommended that pregnant patients with COVID should deliver at a large public hospital, as they need to be managed in facilities that are equipped to provide quarantine and supportive care during and after delivery.
After a baby is born, it is not uncommon that every single person wants to come over and see the new mother and new baby. So that's the first thing that we have to realize, that we are not in the usual time and space where everything was fine and dandy for everybody to come over and it would be a happy moment for the entire family. So social distancing works, and at that point in time, if social distancing becomes very important, this newborn is unlikely to have any vaccinations or usual immunization program. So they would have at most only have gotten the BCG at that point, and in the same breath, there's no COVID-19 vaccine for children at this point. So we have to protect the infant at that point and ensure that we don't have too much visitors coming over to expose the infant to and to expose a new mother to as well. Because her health is also very important, so that she can look after this newborn infant, look after herself with respect to breastfeeding. The second thing is that, particularly for those mothers who have taken the vaccine, those mothers who may have been recently diagnosed with COVID-19, breastfeeding is encouraged because the antibodies that are made against COVID-19 are passed on to the infant during breastfeeding. So we've always heard that breast is the best. It definitely is. So we encourage mothers to breastfeed during that time to build the immunity for the infant as well. The third thing is that we have been hearing in the news and in all sorts of social media that many women are suffering from issues with mental health, anxiety, depression, adjustment disorders. And during that time, with the hormonal changes that happen after delivery, as well as the stresses of being a new mother and feeling as if, you have to take responsibilities for this new infant, yet your body is undergoing so many changes at that point, you do feel the pressures and the anxiety, and sometimes it leads off into depression. Sometimes just because of the hormonal changes, women experience postpartum blues. It's at that time that you require a lot of emotional support from your partners. So I would encourage that the partners who should be involved in the care of the newborn is brought into the picture and assist the mommy with caring for herself and for the newborn, as well as offering her the emotional support that she needs at that time. From a healthcare side, we need to recognize that we have to work as a team, and we need to maintain team support, and we need to recognize what's going on with each other so that we can support each other very well. In our healthcare system, we don't have much room for maintaining mental health for our workers, and burnout is real. It's not uncommon nowadays to find that our younger staff, you see them suffering in a little corner, you notice their expressions look different, and you have to pull them in and say, what's happening. So we all have to be our brother's keepers and recognize when somebody is not managing and try to help them out from the healthcare side. From the patient side, the issue that I think we need to recognize is that we need to take responsibility for our health. So pre-pandemic was free for all. We left a lot of the healthcare advice to our physicians, but now it is out there, and we hear about the fact that we need to maintain a healthy lifestyle and eat properly and exercise. Before coming into pregnancy, it is paramount that you try to practice these things. And also, whilst pregnant, you have to ensure that your health is optimum as well, so that you have a healthy baby at the end.
The big lesson in all of this is the importance of telehealth, which I really can't overemphasize. I mean, telehealth has been around for many, many years. But never before have we had to rely on it as we are now. So for example, the follow-up care after the woman has her baby, sometimes even before our routine 6-week check, a patient may need a blood pressure review. That's a classic one, actually, to see if her blood pressure is being controlled on whatever medication we might have placed her on. Previously, we'd have women come in for things like that, just like that, I should say. But now patients can check their blood pressures at home, phone in, or, whether it's with a video or not, but even so, and have their meds altered, and, the care is administered right then and there, via telehealth. So that for me has been a very big lesson that has proven to be very useful at a time such as this.
Our guest today is Harvard-educated obstetrician and gynecologist Dr. Monique Renford. Welcome. So Dr. Renford, does pregnancy increase the risk or death from COVID-19?
It absolutely does, unfortunately. So while on a whole, pregnant women are no more at risk of getting COVID-19, if they do get ill with COVID-19, they're more likely to be admitted to the ICUs, more likely to be mechanical ventilated, meaning intubated tube down their throat, and frankly, more likely to die. So definitely pregnant women are more at risk of severe disease with COVID-19.
Has COVID-19 exposed any new gender disparities or exposed any existing ones? And if so, what specifically?
It certainly has, because it has disproportionately affected women in terms of the workforce. More women are likely to be unemployed and have lost their jobs in the pandemic. And as we well know, women share generally the more of the burden, so to speak, or the responsibility, let's call it, of caring for the household and caring for children. So with COVID-19, the fact that the children are at home, and then the women have had to take care of the children at home, have had to homeschool their children. And this is even worse for Black and brown women who have lost more jobs, or more likely to be unemployed because of the pandemic, and of course those burdens. And then not to mention the issues with domestic violence, because we do know that domestic violence increased with lockdown, and we do know that domestic violence disproportionately affects women more than men. So in many ways, COVID-19 has really heightened gender disparities. And I want to add, this is despite the fact that initially, or the first part of the pandemic, men were disproportionately infected and dying from COVID-19. But when you look at the data now, that is not true everywhere. In some locations, women are more likely to die than men from COVID-19.
How do these disparities affect pregnant women?
So pregnancy is a difficult time for women in general. So of course, while I can't say based on stats that it would be heightened, but the very fact that we know that pregnant women are more affected if they get ill with COVID-19, and the very fact that we know that pregnant women are at risk for domestic violence, and then of course their capacity or capability of protecting themselves is decreased. So we see all these risks. And we don't know all the data. Often it takes a while for data to catch up and for us to look back and know. And sometimes even the time to look at the data, because right now the focus is taking care of this pandemic, putting this pandemic behind us, getting people vaccinated. So while some people might be looking at the data, a lot will emerge about this whole period and more information will come out. But it certainly doesn't look good for women and the pandemic from the information we have now.
What about a COVID-19 vaccine? Should pregnant women take it, and why?
So the American College of Obstetricians and Gynecologists stated quite early after the vaccine came out that it should not be withheld from pregnant women who are at risk for COVID-19. And they base this on some information that they have, and this information increases. They already knew that if a pregnant woman gets sick with COVID-19, the risk of, as I mentioned, being a mechanical ventilation, ICU admission, and even death is worse. They also know that there was no theoretical risk with the mRNA vaccines. That's the Pfizer and Moderna vaccines. They have more information that there's none of those theoretical risk or risk in animal studies for any of the 3 vaccines that are approved in the US now, Pfizer, Moderna, and the J&J vaccine. So basically, we have that information. what we have now is that pregnant women have received the COVID-19 vaccine in the US. And so far, it does not appear to be any higher risk of side effects than non-pregnant women. And what they notice that the background risk of adverse effects for pregnant women, bad effects for pregnant women, is not worse than the risks of these bad effects with the vaccine. What we don't know and won't know is, of course, we don't have long-term data, years and years and years. The problem is the risk is now, and the pandemic is now. And many pregnant women don't have the luxury of waiting. Some who consider themselves at low risk or who are at low risk may decide to take the vaccine later or in the postpartum period. But those pregnant women who are at very high risk really have to think about what is known and what their risks are and the possibility that they could be risking their life if they get infected. And so that's what a pregnant woman has to think about and weigh. And so as physicians, we guide women in that decision. It's hard for us to say yes or no. We can just offer guidance. And ACOG said should not be withheld. And a woman's decision whether to get vaccinated or not to get vaccinated should be respected, because women have to consider their individual risk with what is known.
So Dr. Rainford, is there anything on the subject matter that you'd like to add?
I would say that I would encourage people who can, in general, to get vaccinated. This is not strictly speaking to pregnant women, because I know that's a difficult decision, because the more people get vaccinated, the more that we can see the end of this pandemic. And as we well know, it's been a difficult time for many, many, many people. And we do want this to be behind us. And in the meantime, encourage people to respect the science, social distancing, wearing masks, avoiding enclosed spaces at close distancing, really doing individuals' part to try to end this pandemic, because all of us want to go back to a more normal, even normal life that we had well before the pandemic. But the only way we can really do it is if people participate in the process by doing their part to make this pandemic end.
Thanks so much, Dr. Rainford. It was a pleasure having you on the show. And to our viewers, as always, thanks for watching. Connect with us. Follow us on Instagram or Facebook at GetThePH. Today's inspirational quote is taken from Dr. Rainford's book, which you can find on her website. If there are things you dislike about yourself, work on changing them. If you are convinced that you can't change them, then learn to accept them.